Hello everyone, this is Dr. Nate from Back to Health, and today we're going to be covering spinal disc injury. I'm going to go through some of the basics with you. Let's start with first a little bit of spinal anatomy. The human spine is made up of 24 individual bones that we call vertebrae, and the vertebrae stack one on top of each other like building blocks, and they're separated by these soft tissue discs on this diagram highlighted in blue. The soft tissue discs have three main functions. The first function is they act as a shock absorber, so they can squish down and bounce back thousands of times throughout the day to protect your spine from injury. The second thing that they do is they act as a spacer, so they separate this bone from this bone and they create some space, which creates this opening right here, and that is the nerve hole where your spinal nerves come out of. And the third thing that they do is they act as a ball bearing for movement. So it's because of these spinal discs that our spines have the ability to move and have mobility. If we were to take and slice down through this spine this way here and then look down on top of it, we'd be looking at this diagram right here, and you can see that the spinal disc again is built like a jelly donut. You can see that it's got this outer ring of ligament. This is not actually one ligament here. This is about 30 to 50 layers of ligament, and it's called the annulus. Contained inside of the annulus, we have this soft tissue material, kind of like a toothpaste consistency, called the nucleus pulposus, and it's basically it's built like a shock absorber, and it acts like one. Looking a little deeper into the anatomy of the spine, you can see again we've got the spinal bone stacked on top of another spinal bone, stacked on top of another spinal bone, separated by these soft tissue discs. Directly posterior to the disc lies your spinal cord. So your spinal cord runs from the base of your skull all the way down into your lower back, right behind where the discs are located at through what we call the spinal canal. And as it does that, it gives off here to the right and here to the left the spinal nerves. So in between each set of bones, directly posterior to the disc, we can see there's a nerve that branches off to the right and off to the left. So here's a nerve, here's a nerve, here's a nerve, here's a nerve, and so forth. Again, a little bit of a different drawing. You can see the spinal bone, you can see how the spinal cord passes down through the inside of the bone, and you can see the spinal nerve given off to the left here and the spinal nerve given off to the right. This area right here is basically where the spinal disc would be sitting. Now when it comes to spinal disc injury, there's a few different degrees of injury that can occur, and you may have heard a lot of different terms kind of thrown around, and they don't all mean the same. There's different things that can happen, and it's important to understand. The first thing you may have heard is like degenerative disc disease. This is where the disc begins to kind of break down and the jelly starts to kind of move and migrate away from the center a little bit. You may notice a little bit of what we call bulging going on, so this has also been called a bulging disc. When the jelly-like material begins to actually push through the donut or the ligament of the disc, we call that a herniation. And as the diagram shows you here, you can see the herniation is what we call contained, meaning that there is ligament still holding that disc material inside of it. The next thing that can occur though is that jelly can actually break all the way out through that disc material, and we call that an extrusion. You may have also heard it referred to as an uncontained herniation. And then finally, as the jelly-like material squishes out, you can get little pieces of the jelly that break off and become free-floating fragments. This is called a sequestration. You may have also heard it referred to as a fragmented herniation. It's important to understand that all four of these situations can range from mild and small, so you can have a small prolapse or a small contained herniation, or you can have a small extrusion, or you can even have a small sequestration. They can range from small and mild to advanced and large, so you can get into situations where you've got very advanced degenerative disc disease, or you've got large extruded or sequestrated discs. But really what we get concerned about in the healthcare field when we're looking at spinal disc injuries is it's all about the real estate. Again, here we are looking down on top of one of the spinal bones, and you can see that spinal canal here highlighted in blue. Basically, there's got to be enough room in here for your spinal cord to pass through. So if that disc material begins to kind of push back in this direction here, and it starts taking up real estate, it doesn't really cause a lot of problems until there isn't enough room for the spinal cord. That's where you start getting into some serious issues. Again, looking at the spine from the side, you can see here's a spinal bone, and here's that disc. If that disc gets injured and it kind of ruptures out the front here, it may cause some back pain for you, but there's really nothing out here that it can cause problems with other than some back pain. It's when that disc material begins to push posteriorly, or it begins to extrude backwards, and it starts entering into this nerve hole. So this is the hole where the nerves come out, and as that disc material begins to push back into there, again, it starts taking up that real estate. It's usually not an issue until there isn't enough room for both the disc material and the nerve, and now that nerve starts to get pinched or irritated, and that's where we start having some problems. So let's talk about the different levels of spinal disc injury. And remember, when it comes down to grading the levels of concern for the spinal disc injuries, it's really all about how the spinal disc injury is affecting the spinal cord and the nerves. So the first situation we have here is maybe a disc injury that is not affecting the spinal cord and the nerves. So we have some degenerative disc disease, we may even have some disc herniation, but again, these are either relatively mild or relatively small injuries. They're not to the point where they're interfering with or affecting the nerves and the spinal cord at all. This is your run-of-the-mill localized neck or back pain, neck or back stiffness. Patients come in with spasms. Maybe sometimes they get like a grabbing sensation when they do certain movements. These types of cases are a relatively low level of concern because, again, even though the patient may be in 8, 9, or 10 out of 10 back pain, there's no indication that injury is affecting the spinal cord or the nerves. The next situation we have, though, is where the spinal disc injury is sufficient enough that it begins to irritate the spinal cord or the nerves. So again, it's not completely smashing on the nerves, but maybe it's just rubbing up against the nerves to the point where it starts to cause them to become swollen and irritated. What you may notice, in addition to having some back and neck pain or some stiffness and spasm, is you may notice something like shoulder blade pain, gluteal pain or pain on your backside, arm and leg pain, so we've heard this described as the term sciatica, hand or foot pain, and also hand and foot numbness and tingling can be associated with the nerve being irritated. The level of concern when we start seeing the symptoms moving away from the spine and out into the extremities, the shoulder blade, down into the butt, down into the legs, our level of concern definitely elevates to something we would consider to be moderate. More advanced than that, though, is a disc injury that is advanced or large enough that it's not just rubbing up against the nerve and irritating it, but it's actually beginning to squish the nerve or it's starting to compress the nerve. What we may see and may find in those types of situations is we may find on orthopedic and neurological examination signs of muscle weakness, loss of reflexes. Patients may describe to us that they go to pick up a carton of milk and they feel like they don't have any strength in their arm, or they pick up a pencil and they drop it. After that's been there, if this type of an injury has been present for a long time, we may even see something like muscle atrophy, which you can see in the picture here with this guy's legs. His right leg is bigger than his left one. Well, that's because on the left side, he had a disc injury that was compressing the nerves that went down his left leg, and the left calf muscle essentially kind of shrunk up on him. Whenever we start to see signs of muscle weakness or loss of reflex on a orthopedic neurological evaluation, our concern level definitely gets elevated, and it's something we would call a high level of concern. Okay, let's take a look at prognosis now. Specifically prognosis with conservative care, like the type of care that we render at Back to Health, chiropractic, traction type therapies, things like that. So no drugs, no surgeries, conservative care. Let's take a look at the research. And I like to look at this because, believe it or not, it really wasn't that long ago that it was believed that once you had a herniated disc, it was permanent. We don't believe that anymore. Let's take a look at some MRI studies here. Here was a study that was done that showed that follow-up MRI 6 to 12 months after the initial injury demonstrated that 50% of patients see about a 70% decrease in the size of extruded disc material. So the jelly that squishes out of that disc and begins to kind of squish the nerve, This study showed that about 50% of patients saw 70% of that jelly got reabsorbed. It's a great study. There's another study here. In the review of randomized controlled trials comparing various interventions for herniated lumbar discs with sciatica, Jacobs et al. Found that after 1 year, there was no difference between surgical versus conservative interventions. So if we go out from the time you start experiencing sciatica to 1 year forward, there's really no difference in this study between patients that had lumbar surgery or they had the type of care that we render at Back to Health. What they did find in this study is that if they opened the person up and they did surgery right away, well, they got relief of their leg pain faster. Well, of course they would. They also had to go through about probably 4 to 12 months of recovery from the surgery. 4 to 6 weeks of recovery for the surgery. But they certainly got rid of their leg pain a lot quicker. When we look at the conservative care patients, it took up to 12 weeks for the conservative care patients to notice resolution of their leg pain. So in the initial phases, if you can kind of tough it out a little bit and give your body the chance to heal like it wants to, and you can get through some of that initial pain, 1 year later, there's really no difference between whether you had a surgery or you just let it heal on its own. Some pretty interesting stuff. Let's take a look at another study here. I really like this one here by Saul. And in a retrospective cohort study, Saul demonstrated that lumbar disc herniation with radiculopathy, so with the sensations down the arms and down the legs, can be successfully treated non-operatively with non-operative treatment resulting in good to excellent outcomes for approximately 90% of patients. So in this study here, this researcher found that 90% of people that deal with neck and back pain that shoots down their legs or shoots down their arms and is coming from a disc herniation can be successfully treated without having to go through surgery. Not only do they recover, but they recover to a level that's considered to be good to excellent. The last study I want to cover with you here, the last myth I want to dispel a little bit, is that I hear patients say, well, my disc was really bad. It was a complete blowout. So essentially what they're referencing is that the disc material like exploded out of their disc in the form of an extrusion or a sequestration. And believe it or not, we actually believe that when these discs completely rupture, they're actually more likely to heal. They may hurt a lot more in the initial beginning, few weeks of the injury, but they actually are more likely to heal better. So here, larger extrusions and sequestrations are more likely to reabsorb. So again, here we are, signs of a disc injury not affecting the spinal cord or nerves, your run-of-the-mill localized neck or back pain, stiffness, maybe some muscle spasm. It could even be really high-level pain. Our actual level of concern is low, and the prognosis with conservative care is very good for these types of conditions. We look at a disc injury or degenerative disc disease that gets to a point where it starts to irritate the spinal nerves a little bit, start seeing some of that shoulder blade pain or maybe even a little sciatica going on. You could even have pain into your arm or into your legs, down into your feet. Our level of concern certainly goes up to moderate, but the prognosis with conservative care is still very good. We look down to the point where we see a larger disc injury where the nerve is not just being irritated, but it's actually being compressed. And I would say that the prognosis is still very good for that. However, I do have to put in here that it can be poor. And the reason is that I don't know why it is, but unfortunately the majority of these cases that make it into my office, this has been in place for a really, really long time. And they've consulted with every surgeon under the sun, and then they say, oh, now I want to try to rehabilitate this and get it better. In those situations, if it's been there a long period of time and you've got that muscle atrophy, the chances of it coming around with conservative care are actually relatively low. So if you suspect that you're having a spinal disc injury, even if it's a high-level injury where you've got 10, 11, 12 out of 10 pain, your leg is numb, you're dragging your leg behind you, the sooner that we begin to intervene on that, the better your chances are versus letting it go for several months and then trying to do something about it. It doesn't work out very well. Let's talk a little bit about how these types of injuries heal. This is a chart here that I pulled out of one of my textbooks, and it ranges from 1 minute after injury all the way out to 1 to 2 years. And you can see that there's a process of healing for these types of injuries that occurs along that timeline. A couple of things I'll point out here is that inflammation, or the part of the condition where you're experiencing a lot of pain, can last anywhere from 4 to 6 all the way out to 12 weeks for these types of spinal disc injuries. The other thing that we see is that here it says 50% of normal tissue strength, and that's anywhere from 3 to 6 months that we're noticing that that disc, even though it's healing, is really only about as 50% strong as it's going to be when it heals completely. And again, we say, well, what does heal completely mean? Well, most studies that are done on disc injuries consider about 6 to 12 months as adequate full heal time. I would say 12 months is almost like a minimum with disc injuries. It can extend out to a year and a half until that disc is healed as much as it's going to possibly heal. Total heal time of 12 to 16 to 18 months is very different than our expectations for significant relief. I define significant relief in my practice as 50% minimum reduction in your symptoms. For small, mild injuries, I expect at the longest 4 to 6 weeks until we see 50% improvement. Can it happen in a week or even a few days? It's possible. Anything's possible. But the expectation is for a mild case or a small injury, 4 to 6 weeks, bare minimum, you should be 50% improved by that point. When we start seeing larger injuries or more advanced degenerative disc conditions, we say 4 to 12 weeks. The range really starts to kind of spread on this. But by 12 weeks at the longest, I would expect a minimum of 50% reduction in symptoms. That being said, I'm human. I understand what you guys are going through. You guys, when you have these types of conditions, they're debilitatingly painful. In the conditions where we have the larger disc injuries or the more advanced degenerative disc disease, it's not uncommon for us to use, in addition to trying to rehabilitate the situation, to refer patients to their primary care physicians to get some type of medication, something to take the edge off to help them sleep at night. That's an important thing for patients to understand, is because they think that they either have to do the rehabilitative approach that we do at our office, or medications, maybe even sometimes spinal injections, that kind of stuff. They have to do one or the other, and that's not the case. In actually a large percentage of our cases where we've got moderate to large injuries, in order to keep the patient comfortable, help them sleep at night, kind of get through the days, it's not uncommon for us to actually put together some medication while we are trying to rehabilitate them and get their body to heal properly. But total heal time and expectations for significant relief really do depend heavily on external factors. So let's take a look at some of the factors that affect healing. The first are things that we can't control. So the first is age. Unfortunately, as we age, we actually heal slower. So that's something we have to take into consideration. Another thing that we have to take into consideration when we're talking about healing is comorbidities. So these are other health conditions that you may be experiencing that would have a negative impact on your ability to heal. So things like diabetes, certain autoimmune disorders, things like that. Anything that's going to affect your body's ability to heal that is also happening at the same time you're trying to recover from this disc injury could slow you down from the healing process. Let's talk a little bit about more about things that we can control during the healing process. One of the things that's absolutely clear to us about healing spinal disc injuries is smoking tobacco is very, very bad. Here's a study here. I can't even pronounce this guy's name, but in 2011, he showed that smoking resulted in more severe pain with disc injury, longer time for reabsorption of the herniated disc material, and smokers have a longer duration of symptoms. Anybody that consults with a spinal disc surgeon nowadays, most surgeons won't even consider doing any type of operation on you unless you give up or you quit smoking. So very, very bad for you. You've got a lot of reasons to quit. Certainly healing from a spinal disc injury is just one more. Some other things that we don't want to do when we're trying to heal up from a spinal disc injury: don't consume excess alcohol. Very importantly, avoid activities that aggravate. Patients very early on in care, they want, oh, what can I do at home? What can I do at home? One of the bigger things you can do is just try not to aggravate it. Basically, these are kind of like a wound. When you cut your hand and it's healing, the one thing you don't want to do is keep bumping it and knocking the scab off of it and knocking the wound open again. These situations are just like that. That doesn't mean do nothing. Stay moving, just be very careful. Support belts, we may encourage you to utilize something like that for a short period of time. Healthy body weight, very important. There's some really good studies out there where they're doing the gastric bypass surgeries on patients, and one of the biggest things that they're noticing improvement with as these patients are losing all this weight is not just all other aspects of their health, but the biggest thing they're seeing improvement with is back pain. So healthy body weight management is important. A low inflammatory diet is very important. This is something you can Google on your own. You can read a little bit about it. Or if you have interest, just ask us at your next appointment. We can talk with you about some dietary changes you can make to try to move your body more towards healing. Also, there's some supplementation that you can use. Again, these are kind of the icing on the cake things that you can do to help yourself move in the right direction. One of the products I offer at my office here, and I'm absolutely in love with it, is called NutriDisc. If you have interest in that at all, just ask me at your next appointment. I can talk with you about that. Your home exercise plan, very important. We're going to be giving you, we're going to start with some gentle stretching and eventually work you into a situation where you're doing some more strengthening of your back as you heal and you progress along. And the final thing is just following doctor's recommendations. And I'd just like to make a point of this here because doctor recommendations in the early phase of care, I don't need much from you, the patient. I need you to be at your appointments. I'll do all the work. We'll work with you on different therapies in the office. You're going to get a lot of this. I may be seeing you daily. I may be seeing you 5 or 4 or 3 times a week. It's going to be a lot of in-office care, and you're not going to have much to do at home. You're just going to take it easy and just try not to aggravate the situation. But as your care progresses, it becomes much less about what we're doing with you in the office. We're going to be seeing you a lot less frequently. We may only be seeing you once a week or every 2 weeks. However, we're going to talk with you about the things you need to be doing at home, including things like different exercises and things like that. This is the biggest area that I see weakness in my practice, where patients potentially don't do as well as I think they could, is because they all follow through with the recommendations here when they just come into the office and I do all the work on them and they don't have to do a lot. But as we switch, as care progresses, and it's less about my care in the office, it's more about them doing things at home, they get a little bit lazy and they kind of fall behind, and they don't get the results that they could. The only reason I'm bringing this up is because don't let that happen to you. Follow the recommendations, do the home exercise plans. We may talk with you about getting a teeter-up table or an inversion table. Follow through with those types of recommendations, because again, you may be feeling better within a period of a month to a couple of months, but this injury is going to take many months, up to a year and a half, to completely heal, and you're going to be doing a lot of that work at home. So that should cover the basics of spinal disc injury. If you have any additional questions or concerns, you can always give me a call at the office, 570-629-9507. Shoot me out an email with any questions you may have at drnate@getbacktohealth.com. Or again, we can always just talk at your next appointment. Feel free to reach out with me any questions or concerns you may have.